Welcome back to my YouTube channel. If you are new to my channel, welcome to Medicalcoding site. Hi, I am Nushaba, a certified medical coder. In this video, we will cover another important topic related to breast in the integumentary system. In this video, we will cover the types of breast biopsies, open excision of a breast lesion, placement of breast localization devices with or without image-guided breast biopsies, mastectomy procedures, and breast repair and or reconstruction. Let's start with each topic one by one, along with guidelines and practice questions. Breast biopsy procedures may be performed via a percutaneous or open approach, and with or without imaging guidance. Important key points you must know while practicing breast biopsy provided on CPT page number 112. Especially when coding for breast biopsy, you must know what the biopsy codes includes and how to handle more than percutaneous breast biopsy using the same or different imaging modality, as well as how to report bilateral image-guided breast biopsies. Age breast biopsy codes include the placement of breast localization device, under which condition this may be reported separately. What is the localization device? How is it used? And what is its importance? During localization, a radiologist implant localization devices, for example, clip, metallic pellet, file needle, or radioactive seed into the abnormal tissue. That will help the surgeon find its location. Then during the surgery, the surgeon removes the localization marker or wire along with the abnormal tissue. Here are some coding guidelines you must know while practicing questions related to breast biopsy. Code range 19081 to 19086 include the placement of breast localization devices when performed, along with imaging guidance, and may not be reported separately for the same lesion. In case of multiple percutaneous breast biopsy, with or without localization device placement, if using the same imaging modality, use an add-on code, regardless of whether the additional service is on the same or contralateral breast. If using different imaging modality, report a separate primary code for each additional biopsy. To report bilateral image-guided breast biopsy, report primary codes for the initial biopsy, the contralateral, and each additional breast images biopsy are then reported with add-on codes. Percutaneous breast biopsies without imaging guidance is reported with code 19100. Open incisional breast biopsy code 19101 does not include imaging guidance. If an open incisional biopsy is performed after image-guided placement of localization device, the code from code range 19281 to 19288 may also be reported for the appropriate image-guided localization device placement. Important key points to know while coding for open excision of a breast lesion is provided on CPT page number 112 include the distinction between the codes used with or without preoperative placement and the condition under which the image-guided placement of localization device may be reported separately. Here are some coding guidelines related to open excision of a breast lesion. Excision may include off lesion of breast ducts, cysts, benign or malignant tumors without specific attention to adequate surgical margins. It may be with or without preoperative placement of radiological markers. If an open excision of a breast lesion is performed after image-guided placement of a localization device, the appropriate image-guided localization device placement code from 19281 to 19288 may also be reported. To report bilateral procedures for the given code, report modifier 50 with the procedure code. Important key points for practicing the percutaneous image guided placement of breast localization devices given on CPT page number 113 are how to manage multiple device placement when using the same or different imaging modality, and how to code in case of bilateral placement. You must know the condition allow for separate reporting when dealing with open breast biopsies or open excision of breast lesion. Here are some coding guidelines related to the introduction of percutaneous image guided placement of breast localization devices. Code range from 19,281 to 19,288 is used for the placement of breast localization devices without image guided breast biopsies. In case of multiple localization device placement without image guided biopsy, if using the same imaging modality, use an add-on code. If using different imaging modality, report a separate primary code for each additional localization device placements. To report bilateral image guided placement of localization, report primary code for the initial lesion localized. The contralateral and each breast image guided localization device placement are then reported with add-on codes. In the CPT codebook, mastectomy or the removal of the breast may be performed because of gynecomastia to treat excessive enlargement of the male breast or for the treatment or prevention of breast cancer, including partial, simple, or radical mastectomies. Here are some coding guidelines related to mastectomy procedure. Mastectomy procedure with exception of gynecomastia are performed either for treatment or prevention of breast cancer. Code 19301 describes a partial mastectomy, where only a portion of ipsilateral breast tissue is removed, may be called as lumpectomy, tylectomy, quadrantectomy, or segmentectomy. When a complex axillary lymphadenectomy is performed in addition to a partial mastectomy, report with code 19302. For simple mastectomy, code 19303 describes total removal of ipsilateral breast tissue, with or without removal of skin and or nipples, for example, nipple sparing. Code 19303 does not include the excision of pectoral muscles and or axillary and internal memory lymph nodes. Code range 19,305 to 19,307 describe radical procedure that include total removal of ipsilateral breast tissue, including the nipple, for the treatment of breast cancer, and excision of pectoral muscles and or axillary or internal memory lymph nodes. Code 19305 involves the removal of entire breast, including pectoral muscles and axillary lymph nodes. Code 19306 removed the entire breast, including pectoral muscles, axillary, and internal memory lymph nodes. It is also called the urban type operation. Code 19307 involves the removal of entire breast, including axillary lymph nodes, with or without pectoralis minor muscles, but excluding pectoralis major muscle. To report bilateral procedure for the given codes, report modifier 50 with the procedure code. Different techniques are used for the repair and or reconstruction of the breast. The first technique is for altering native breast, which is done through mastopexy. in which the provider lifts the breast and breast mount. Breast reduction involves the reduction of the breast volume. Altering native breast is also achieved through breast augmentation, which involves the use of breast implants. Techniques for post mastectomy breast reconstruction are based on the placement of fluid filled device, for example, saline or silicone gel for breast volume. It may be immediate or delayed reconstruction. In immediate, an implant is placed at the time of a mastectomy. In delayed reconstruction, an implant is placed at the later date separate from mastectomy. A breast implant cannot always be placed due to the lack of an adequate skin envelope. In this scenario, a tissue expander is used and implanted to create an adequately sized pocket for the subsequent insertion of permanent implant. The tissue expander is eventually removed and may be replaced with a permanent breast implant. Autologous breast reconstruction involves harvesting a flap of skin, subcutaneous fat, and or muscles from another area of the body. Flap may be a flattimus dorsi type, free flap like F-tram deep, SIA or gap flap, or single or bipedical tram flap. Secondary and ancillary breast reconstruction procedure involve nipple reconstruction, capsular revision, or complete capsulectomy, which involves the removal of entire breast capsule to achieve proper positioning. Knowledge cast formation for custom implant involves the creation of a knowledge cast of a patient's chest defect. The mold is used to fabricate a specific custom made implant tailored to fit the patient's unique defect. What is the appropriate CPT coding for bilateral breast stereotactic core biopsy, including the successful deployment of the tissue marking clip in the biopsy cavities, with two biopsies taken from the left breast and one biopsy taken from the right breast? Option A with the service code 19081 and 19082 into 2. Option B with the service code 19081 into 3. Option C with the service code 19283, 19284 into 2. Option D with the service code 19283 into 3. The procedure involves the bilateral breast stereotactic core biopsies, including the successful deployment of the tissue marking clip, two biopsies from the left and one biopsy from the right breast. Ace percutaneous image guided breast biopsies include placement of breast localization device like clip or metallic pallet when performed. We will first eliminate option C and D, which include codes for the percutaneous image guided placement of breast localization device without image guided breast biopsies. Both remaining option A and B are used for percutaneous image guided breast biopsies with placement of breast localization devices. Since bilateral breast stereotactic core biopsies are performed, we must follow the guideline they state to report bilateral image guided breast biopsies. The initial biopsy is reported with the primary code, while the contralateral and each additional biopsy are reported with add-on codes. As three biopsies were done, the initial biopsy is represented with the primary code 19081 and the remaining two are reported with the add-on code 19082. Therefore, a correct option is option A with the service code 19081 and 19082 into 2. A day prior to procedure, wire placement in the lower outer aspect of the right breast was performed by radiologist. During the operative session, the surgeon created an incision to the wire tract which was followed down to its entrance into the breast tissue. A nodule of the breast tissue was noted immediately adjacent to the wire. The entire area was excised by sharp dissection, sent to pathology, and returned as a benign lesion. The subcutaneous tissue was closed with vacral suture. The skin edges were approximated with subcuticular suture, and adhesive strips were applied. The patient left the operating room in the satisfactory condition. What should be the correct codes for the surgeon services? Option A with the service code 19120 along with modifier RT, which is used for the right side. Option B with the service code 19125 along with modifier RT 19285. Option C with the service code 11400 along with modifier RT. Option D with the service code 19125 along with modifier RT, which is used for the right side. The procedure involves the excision of a benign lesion of the right breast performed through an incision along the white tract placed a day before to the procedure. Since the procedure is performed on the breast and we have separate corset for breast procedure without specific intention to the adequate surgical margin, we will first eliminate option C, which include code 11400, which is used for the excision of benign lesion including margins. After eliminating option C, all remaining option A, B, and D is for the procedure related to open excision of breast lesion without specific attention to adequate surgical margin with or without the preoperative placement of radiological marker. As the procedure was performed through an incision along the white tract placed a day before the procedure, we will also eliminate option A with the code 19120, which is for the open excision of the breast lesion without a preoperative placement of radiological markers. We will also eliminate option B because the code 19285 is used for the placement of breast localization devices, which is already included in the code 19125. So our correct option is option D with the service code 19125 with the modifier RT, which is used to indicate the right side. What CPT code should be reported for right breast lumpectomy performed on a 24-year-old female with right breast mass that has grown in the size and need to be excised? Findings at the time of the operation revealed a fibroadenoma. Option A with the service code 19302. Option B with the service code 19301. Option C with the service code 19303. Option D with the service code 19120. In the given scenario, right breast lumpectomy is performed. As this procedure is related to mastectomy procedure, we will first eliminate the option D with the service code 19120, which is used for open excision of a breast lesion. After eliminating option D, all remaining option A, B, and C is for the procedure related to mastectomy. We will also eliminate option C with the service code 19303, describe the total removal of ipsilateral breast tissue with or without removal of skin and or nipples. Both option A and B are used for lumpectomy. Code 19301 describe a partial mastectomy only when a portion of ipsilateral breast tissue is removed. We report code 19302 only when a complete axillary lymphadenectomy is performed in addition to partial mastectomy. Therefore, a correct option is option B with the service code 19301. A 40-year-old female with a congenital left breast deformity underwent placement of a left breast implant filled with 475 cc of normal saline for breast reconstruction. Approximately 15 to 16 years ago, she had a left breast implant placed for the same purpose due to her congenital deformity. This implant ruptured, and in the late September, following a capsulectomy, her ruptured implant was exchanged for a new one. About a week after surgery, the patient developed an infection which necessitated the removal of her implant. The infection has now completely resolved and she is ready to have her implant replaced. What CPT and ICD-10-CM codes are reported? Option A with the service code 19325 along with modifier LT and 64.89. Option B with the service code 19340 along with modifier LT and Q83.9. Option C with the service code 19316 along with modifier LT and 64.89. Option D with the service code 19342 along with modifier LT and Q83.9. In the given scenario, implant replacement for breast reconstruction due to congenital left breast deformity is performed. Since the procedure is for repair and reconstruction of the breast, we will first eliminate option A, which include the code 19325, which is used for breast augmentation, with an implant that is used for increase the size and volume of the breast. We will also eliminate option C, which include code 19316, which is used for mastectomy, which is also known as breast lift. This procedure may involve the removing of the excess skin from the breast and tightening the surrounding tissue. The codes given in option B and D both involve implant-based reconstruction, which include the placement of a device filled with fluid to provide the volume to the breast. Code 19340 pertains to immediate reconstruction where the implant is primarily placed at the time of surgery. Code 19342 is for delayed reconstruction, where an implant is placed at a date separate from the surgery. This includes the placement of a new implant or the replacement of an existing implant within the defect or reconstructed breast. Since the procedure involves placing an implant at a separate date from the surgery, a correct service code is 19342. Additionally, we will use code Q83.9 for congenital malformation of the breast. Therefore, a correct option is option D with the service code 19342 along with modifier LT and Q83.9. Thank you for watching. If you have any question or need further clarification, please feel free to write in the comment section. For more detailed guidelines, CPC mock exam related questions and notes, email me at the giving email ID.